Hello, everybody. We're live with Ed Harrold on our Facebook page, and I would like to introduce Ed Harrold. He is a breathing coach. Ed, can you kind of explain what that means? I'd love to hear about that.
Yeah, over the past 20 years, I've developed some skills in regard to helping people add breath to the parts of their life where they seem they're not breathing at all. And the science is coming out to help us understand how important we're breathing in our life is simply enough to take your breath away.
Interesting. So I would like to ask, what kind of patients do you see? What's your goal when you meet these patients?
Well, most of the time when I meet folks, they're mouth breathers, or they are breathing through their nose, but almost really shallow, like a rabbit.
Right.
So
Okay.
there's almost this state of mild hyperventilation is taking place, in their waking hours, which also affects the quality of their sleep. So just getting folks to commit themselves to what I would call nostril, slower diaphragmatic breathing,
Okay.
which sets in motion many, many good things that were present for us at our birth. And repatterning the breathing plays a huge role in inflammation reduction, amplifying the brain's ability to decompress where it is tight, opening up the TMJ joint, expanding the upper jawbone so the nasal airways are wide open, and drawing that lower jawbone out slightly, which creates a relaxation response in the connection between the brain and the mind.
Interesting. The interesting thing, too, is I actually, after I met you the first time a number of months ago, I walked home one day, which is about 2.0 miles, and I said, all right, I'm going to do this. I'm going to breathe through my nose the entire time as I walk home. And within the first 2-3 minutes, I actually got very panicky. I had a hard time breathing, a hard time even making it work. But then it was very interesting how I breathed only through my nose. Within about 5 minutes, the dizziness passed, and I actually started looking up at the sky and the clouds rather than looking down at my feet. So I took your words to heart there and worked with it. It made a big difference. The hard part is really just keeping that going and being conscious of this. Do you have any tips on how to do that?
Yeah. Well, number one, in your explanation, that is where 99% of the people are. They immediately find right off the bat that there's like this wall, this psychological, physiological wall that blocks them from going slower, deeper diaphragmatic breathing. And for everyone out there who's listening right now, I just invite you just to take a full, complete inhale, filling the belly first, letting the breath give you support in your low back. Because notice when you were walking, initially you were looking down.
Right.
And then as the diaphragm and the vagus nerve became more dynamic, subconsciously the posture readjusted itself and the skull balanced perfectly on top of the occipital ridge. So this practice of breaking through that initial little lightheadedness is the most difficult part for folks, and to hang in there during that transition piece where the body seems to be going through a slight progression of learning how to handle higher levels of carbon dioxide in the system, and at the same time drawing the oxygen particles out of the carbon dioxide. And as we begin to handle higher and higher levels of carbon dioxide and keep the cardiovascular system, the heart rate and the blood pressure down, amazing things happen for digestion and elimination. And then looking at our neurochemistry, so we're always seeing the best in ourselves, and we're always growing and learning and being neuroplastic in regard to this amazing thing we call life and evolution.
Very interesting. It ties in a lot with the work that I do with these ALF appliances. I find that our patients, they breathe better, but I still find a lot of them need a coach to kind of get them over the barriers. Best way to describe it. It always helps having a coach direct your actions and make you do what you're supposed to do. That's what I'm finding very frequently. So can you kind of maybe, you have a good handle on what I do at this point, I would imagine.
Yeah.
Yeah.
And, what you're doing, both in and out of the office, Jeff, is amazing. This push that you have to get your work covered by insurance carriers is so important to reducing pain and suffering for the clients that you see. This should be a seamless application to help folks not only interact in their own mind, but how they interact in the world. And I run into the same problem, trying to get the insurance carriers to take a hard look at how important how your breathing is in regard to your overall levels of mental, emotional, and physical health. So we're kind of both in the same battle here.
It is. I just wrote the first piece
down the road.
I just wrote my first piece of legislation, and it might be in front of the Virginia Senate next month or two. So we're trying, at least. And in the state of Virginia, TMJ coverage is mandated by law, by the way, even though the carriers have denied services. Really interesting how these super nice people at the insurance companies have figured out how to weasel their way out of paying. But we're battling, we're trying. Now, Ed, I want to ask you, though, what can a patient do at home? Like, do you have, I guess the way to express this would be that people ask me, what the heck is a breath coach, and why do I need one? Can you answer that question, please?
Yeah. So most of the people who we run into during the day they're breathing, they're surviving, but they're not thriving. And one of the reasons that we want to work on our breathing and get some context of why this is so important is because we look at the overall stress levels that we're putting on the various systems of the body, and we can see that degenerative disease and things that are occurring that used to occur when folks were in their 60s and 70s and 80s are now coming to our clients in their 20s and 30s. And there has to be something that's different. And what I would offer is that stress levels have risen to an all-time high. And there are many, many reasons for that. But one of the things we want to do is we want to cool the systems down where we're overheating. We want to put structurally the face, the skeletal framing members back into place. When they're back into place, the conversation that takes place between your passion, what's in your heart, and your thoughts and perceptions that are in your brain become amplified. So learning how to control the stress so the stress doesn't control you. Well, your number one tool in your toolbox is to notice that when you're stressed, you've lost your ability to exhale. And you'll notice that you're actually poisoning yourself from the inside out. Your heart rate's going up, your blood pressure's going up, your brainwave activity is shooting way up. There's many, many thoughts. And you don't have the ability to control the moment, so the moment controls you. So teaching people, number one, a slow motion nostril diaphragmatic inhale is the number one tool to organizing the mind mentally to make a good choice. Number two, always exhaling through your nose, and exhale longer in length in time than your inhale. And this sets in motion fat metabolism. So we're always burning inflammation. We have a strong reservoir of serotonin and melatonin, so we get a good night's sleep. We're calm during the day. And we keep cortisol levels down, so we're not draining our adrenals. We're not draining our immune system. And we always have a large reservoir of relaxed energy to deal with the peaks and valleys of today's world.
It's interesting talking to you. Just this entire time, I've made sure, very sure, that I'm breathing in and out through my nose at all times. I would imagine that pretty much most of you that are listening in, doing the same thing, breathing in through your nose and breathing out through your nose with your mouth sealed. Very, very important. And actually, I saw a neat article the other day. There's some doctors out there that promote, oxygen getting in through an appliance. I've seen this years ago. But then they're starting to talk about sleep deprivation is the biggest killer we have these days. And I believe that is one of the big stressors that I see a lot here. Most of the people I meet the first time are sleep deprived, and they're not feeling too good. And everyone, Ed, that I've ever had a sleep study done on seems to have sleep apnea. So far, just about every single person.
It seems like everybody's running on too many RPMs during the day. And you know what? If we're too hot during the day, the way I look at it is there's too many heartbeats during the day. And then the brain can't cool down enough between that time of 6 or 7 o'clock when we get off work, and then we decide to go to bed at 10 o'clock, there's too much adrenaline in the system, and the brain doesn't sense safety. And when the brain doesn't sense total safety, and you don't have energy on reserve from what you did during the day, you just pass out between like 11 and 2:30, and then when the 2:30 comes and there's no melatonin left in your system, you're going to be tossing and turning until sunrise. You know.
Wow, funny you mention that. That's me to the T. I wake up at 2 o'clock every morning like clockwork, and it's like, okay, I should probably go to the office now because I'm done. And I'm still tired. I'm always tired.
Yeah,
Interesting.
so really, you know, everybody's in some sort of level of exhaustion. And, you know, the body doesn't do well with that. And things the body doesn't do well with have a tendency to affect the brain and obviously affect the heart. So if we could just look at a simple formula that how many breaths you're taking per minute your respiratory response is going to dictate your heart rate. Your heart rate is going to dictate your blood pressure. Your blood pressure is going to dictate your neurochemistry, your perception of being a victim or a creator in any given moment. And then the brain is going to dictate whether you burn fat or sugar. And we only want to burn sugar in emergency situations. We want to have a large reservoir of glucose in the system, keeping our immune system strong, keeping the brain sharp, and not getting overheated during the day. So if you're taking more than 12 breaths per minute right now, I think the average science says that you're in a state of sympathetic fight or flight 24 hours a day, 7 days a week. And that's no way to be a human being.
Wow. Hey, there's a question. Gail Pollard said, I wonder if there's a correlation between higher stress and the use of electronic devices, especially related to social media.
I would say without a doubt.
Yeah.
You know, we have to create boundaries over all the gizmos that we use to communicate in today's world. A lot of this stuff is great, but it can become very parasitic in regard to draining our energy. The radiation, the lighting that comes off of all of our appliances drain the brain. And when the brain is drained, then the body becomes exhausted and we become ungrounded, and then it becomes more difficult for us to smile. So setting healthy boundaries around all the tools that we have to make life as easy as possible for us so that it doesn't become something that holds us back. Very good question.
I would have to agree with you very much on the electronics. I find that most of the kids I see these days are hooked. They don't get outdoors. They just simply they play in games all day, which obviously not very healthy. Well, let's see. Back to the breathing issue, Ed. Can you give our viewing audience a little bit of information about what do you do specifically that you would help a patient with? What is it you do is the question. I think a lot of them would like to understand that a little more, perhaps.
So opening up the airways and the distribution of oxygen is huge to your overall level of vitality and your level of how you're working with your brain and your mind. So when we look at the structures of how the face is structured, you know, obviously we want to open our airways as wide as possible. So practicing, number one, having the tongue rest on the upper jaw. And having that tongue pressing out like that splays the teeth wider along the upper jawbone, which allows the nostrils to flare open. So practicing this when you're home, when you're exercising, wherever it may be, opening up your airway is one of the number one tools to setting in motion good health on every level. So learning how to control the length, depth, and pace of your inhale and exhale, and creating wonderful posture in the brain and distribution of blood and oxygen and nutrients through the facial nerves. You know, the facial nerves play such a huge role in regard to how the cranial nerves are helping us set up the moment, whether it's stress or non-stress. Breathing through your nose also has scientifically been proven that it's a huge secretor of nitric oxide.
Right.
Nitric oxide is a huge anti-inflammatory molecule. And when we're working with structural issues or we're working with issues that require a smoother distribution of oxygen, you know, we want to have that nitric oxide there at our doorstep.
Yes.
So learning how to inhale slowly is where we want to first start with people. Slow diaphragmatic breathing on the inhale. Now, there's faster diaphragmatic breathing that you can bring into your exercise routines, which is an amazing tool so you don't have to pan or hyperventilate through your mouth or mouth breathing when you exercise. mouth breathing and exercise is simply a signal from the body that you're working too hard at the physical level right now, and being patient with the body, because the body doesn't have an ego, but the head does. It has certain goals and strategies, and it's always, more is better and blah, no pain, no gain. The idea is to be able to monitor the breath on the inhale. You'll notice, are you grounded? Are you ungrounded? What's my thought process? And working with right there, slow or moderate or fast diaphragmatic breathing through the nose is huge in regard to the structure of the face, the structure of the brain, how the cardiovascular system and the neuromuscular skeletal system are going to interact.
So Ed, what do I do I'm at the gym. Man, I'm huffing and puffing. I know I'm overweight and all that, but I breathe through my mouth all the time at the gym. I try to breathe through my nose, but wow, it's very, very difficult.
Yeah. So getting folks to learn a completely different strategy for self-care is what I'm all about. So when you look at exercise-induced stress, what I like to do is I like to keep the various systems in the recovery mode during or a parasympathetic response as much as possible in a sympathetic action like exercise. So I'm looking at heart rate variability science and how much can we have cooling in the system while we're in a workout system that's designed for heat and sweating. So when you begin to stay on that exhale when you're exercising, a lot of amazing things happen in regard to not overheating the system. The sweating, we don't need to sweat as much as we do. And when you create sweat, what I'd like to do through the breathing is I like to get it to come out of the abdomen, and the gastrophile, the gastrointestinal juices that come out of the gut are much hotter and detoxifying than lactic acid coming out of the body. So slowing down what you're doing is very, very important, because if you can use breath control to raise and drop your heart rate, and you're not putting as much wear and tear on the joints of your body, it's easier for us to stay in shape. If you think about it, if you're trying to lose weight, you're in an inflammation reduction program. You're trying to reduce mucus, phlegm, and fat.
Right.
When the brain senses safety, it allows the body to organically and naturally metabolize its fat stores. When the heart rate gets up over 75%, the brain senses fear and stops burning fat, and all the energy leaves the gut and goes out into the muscles to fight or flight. Now, the problem with that is that nobody's dying of muscle cancer. People are dying of organ cancer. So the issues around exercise and inflammation should be around cleaning out the lower part of the abdomen, the hips, glutes, that area of the body. And then when that gets more optimally fit, then the rest of the body will shape itself very, very efficiently around what the diaphragm is doing.
Okay, that makes a lot of good sense. It ties in really well with what I do every day too. I guess most of the people I see know that I do a lot of ALF appliances, which are designed to open up the palate, create some more room for the tongue, get the tongue in the proper posture, and improve nasal breathing. And what Ed mentioned was with nitric oxide, that's produced in the paranasal sinuses way up in here. And as long as you're breathing in and out through your nose, you'll get a lot of good nitric oxide. And nitric oxide was made the molecule of the century by Time magazine a year or 2 or 3 ago. Very interesting molecule. So it's all something we all need. So Ed, as a kind of a wrap up here, as far as what is your website, please, if you would?
Yeah, my website is www.edharrold.com.
Spelled EDHARROLD.com.
Thank you.
Oh,
thank you.
I'm glad we could talk, because this is always very interesting. If anybody has any questions, pop them up right away. We'll have to wrap up here in a few minutes. We generally go 15 minutes or so, and otherwise it gets to be a long session. But I work with Ed I've got a good handful of patients that I've referred to him at this point in time, and some of them have a hard time grasping what you do, to tell you the truth. And I get the comments like, well, I know how to breathe. And I respond back saying, you may know how to breathe, you also know how to walk, but you've also probably had a coach when you were in high school telling you how to play tennis, how to play basketball. Well, if you had a coach that taught you how to breathe in high school, you would have played ball better. That's what I tell these folks. And they're like, oh, yeah, well, that kind of makes sense now. So that's what I believe you're all about, is being the coach that can get people breathing better, feeling better for long term without as many medications as they normally would have taken. I can speak personally that when I breathe through my nose and I really work at this hard, I could use a coach every day kicking me in the butt, telling me to do it better. So, yeah. So anyway, that's the concept here, folks. And anything else to add, Ed?
Well, I would just say that it's always great to be with you and your audience, Dr.
Thank
Brown.
you.
You're such an amazing human being, and you're helping so many people who just think there's no help for them in the world, and that just touches my heart so deep. And I'm just so happy to be a spoke on the wheel of what you guys are doing.
Much appreciated, Ed. Well, thank you so much, and I'll wish you a nice one and a great holiday season. Enjoy yourself.
Same to you and your family. Merry Christmas.
Merry
Happy
Christmas.
Hanukkah.
Thank you, Ed. Take care.
Bye-bye.
Bye.